Hello, everybody, and welcome back to the Outcomes Rocket Insights from AHIP Series 2024. We're recording live here in Las Vegas, Nevada at the Wynn. And today I have the privilege of having Salome Tibebu with us. She is the founder and CEO at Behavioral Health Tech. Salome, thanks for joining us.
Oh, thank you, Saul. I'm so excited.
Yeah, it's such a pleasure to have you here. Now, you just finished your panel.
I did, yes.
Tell us about what the panel was all about, and then on the tail of that, a little bit more about yourself.
Totally, yeah. Our panel had payer, employer, and digital mental health innovator representation, and the key theme was payer partnerships with digital health innovators that, in particular, help with triaging the member to the right service. And this is really important in behavioral health because you might have a very specialized condition like eating disorders, OCD, and there are so many solutions now. And payers need to be mindful of ensuring that they can treat the right level of care, the right condition. They need to be able to triage members to the right vendor, frankly. And so it was really exciting to see this real world example come together.
Yeah, it's great, and I love that the panel focused on this collaboration. I mean, we believe collaboration is the most valuable currency, especially in an area like behavioral health.
Mm-hmm. Oh, hands down. I could not agree more. As somebody who organizes the largest community focused on expanding access to mental health, substance use, and IDD care through technology, health equity, and innovation, our main objective at Behavioral Health Tech is bringing together all stakeholders, whether that's health plans, employers, benefits leaders, digital health companies, investors, policymakers, to discuss what are those barriers that are prohibiting the expansion of access to behavioral health, and what are some real-world examples that pioneering partners are doing that others could learn from. That is my main mission, and so I couldn't agree more.
That's awesome. Thanks for sharing that. And so the focus is clear. What got you into this? What got you started on this journey in behavioral health?
Right. Yeah. So I'm not a clinician or a technologist, but really somebody who comes into the space with lived experience. I had really bad anxiety and obsessive compulsive disorder as a teenager. And at the time, I really couldn't even find anything online to help me. And so in 2006, when I was 16, I started one of the first 14 by teen online resources all about teen anxiety.
That's awesome.
That was my first it was really janky. It was very basic, but
that's how all things start.
The connection was my objective. And so that was my first taste of behavioral health technology innovation, and that led me on this path.
Amazing. You've been interested in it for a while. You were dealing with a couple things of your own, as we all do. And you just didn't find answers, so you created them.
Exactly.
And I love chatting with entrepreneurs that is the driving force. Is like, I was looking for this answer and it wasn't available, so I created it.
Yes, which, in hindsight is like, did I have to? But yes.
Yeah. And by the way, folks, like, how many of you are in that chair, in that place where you wanted an answer for something and it wasn't there, so you did it? You're not alone. There's a lot of leaders like you out there, and it's possible, as Solome has done with behavioral health tech. You can create solutions that take healthcare to the next level. Okay, so now we're here at AHIP, and everybody wasn't able to attend. The people that are watching and listening to this, what insight has risen to the top for you thus far?
Mm-hmm. Yeah, I think in the spirit of collaboration again, I would say for those who could not participate or even plans who were here, one big takeaway is to learn from more, shall I say, first movers or pioneering plans that have stepped out to try new reimbursement models, to adopt novel solutions in behavioral health. Because there are so many amazing innovations in our space right now that are actually reaching and engaging members who historically were not getting access to care. It's young people, people of color, there's a lot of stigma, so many reasons, but now innovators have found ways to reach and engage them, but plans might not necessarily have even the payment model to do it. but there are some pioneering plans that actually have and are talking about them. And I think there's still a lot of learning amongst one another that can happen to disseminate that learning.
That's really great, and a great call out, right? Because there has been that gap in payment codes, in reimbursement. So I love that you're bringing this up. Do any come to mind that you want to maybe share about?
Yeah, I mean, even the idea of coaching for mental health came up on our panel, and NovaWell, Suzanne Kunes, CEO of NovaWell, talked about how they were one of the early innovators to be able to cover coaching in the mental health space. And there's a really important place for coaches. Not only do we not have enough clinicians to meet the demand for mental health and substance use issues, but when it comes to coaches and peers especially, they might be able to reach and engage members even more successfully to take that first step to get the care they need. And a lot of payers are still not reimbursing for that yet.
Yeah, great call out. Thanks for calling out NovaWell and their innovative ways. And we got to learn from each other to advance
Absolutely. Yes.
Okay, Salome, so thank you for that insight. Definitely something we could all do something about. What would you leave our listeners and viewers with as a call to action? And what's the best place they could get in touch with you and your team?
Yeah, I'd say it's not easy to do all the time, but staying abreast of what is happening. Our space is moving quickly. And so, there are some newsletters that could help people stay informed, like Behavioral Health Tech, which goes out every Thursday.
That's a plug, guys, by the way. That's a plug. We'll leave it in the show notes.
Exactly, yes. and that's frankly the easiest way to find us, behavioralhealthtech.com, and of course save the date to join us in November in Phoenix, November 5th through 7th.
Okay, so what's going on in Phoenix, November 5th through 7th?
That is our second annual convening where we're bringing together all of those stakeholders once again. And
Amazing.
So that's national and regional health plans, commercial, Medicaid, Medicare, along with providers, innovators, just in behavioral health though.
Okay, yeah, still, that's a great opportunity. So great that you guys are taking the initiative to create that forum for discussion. So kudos to you for your leadership there. And folks, take advantage of it. We'll leave, do you guys have any landing page on that yet? Or yeah? Okay, cool. So we'll make sure to link up that opportunity for you to attend this awesome gathering brought to you by Behavioral Health Tech. So make sure you check that out. Check out the show notes for the summary of today's interview with Salome. Really appreciate you all tuning in for our series. Stay tuned for the next ones. And Salome, thanks so much for being with us today.
Oh, thank you. Thanks so much, Sal. Appreciate it.
Thanks.